Welcome to a new episode of Zebras Underground. My name's Christy, and today I'm going to talk about something that's really hard for people with chronic illness, especially EDS or a connective tissue disorder, and some of its comorbid complexities like dysautonomia or POTS or mast cell issues. And that's you need to learn to self-advocate. Absolutely. Get yourself organized before you go to your doctor appointments. But how do you advocate when you're running on empty? When you're fatigued or your brain fog and all those things are flaring up and you literally cannot figure out how to coordinate all this complexity. When at the end of the day, we want to be heard. We want to be seen, and we need some validation that, yes, this stuff that I'm going through that's all across my body that makes no sense, that doctors keep dismissing me, it is real. And I am super exhausted and fatigued, and my brain is not functioning, and I cannot manage this enormous amount of complexity to just get care when I feel invisible. So, if this is resonating with you, welcome to the club. Hopefully today, as a board certified patient advocate, I can provide some strategies for survival that can reduce the emotional load or give some tiny usable steps to help you navigate your way through this. And, share a little bit of my story, because my story is just like your story. We're kind of DIYing our diagnosis and being forced to get kind of our own doctorate degree, trying to learn the medical system so we can better navigate it and go in and communicate our symptoms. And we're forced to kind of learn how to tie, I have, this nerve pain over here, and that may associate with this. But, and a great example of this happened to me today, which is the motivation for this talk, is I was recently, within the past year, diagnosed with adrenal insufficiency, which can be a pretty serious condition where your body doesn't produce the cortisol that it needs to respond to stress of, everyday life or illness or all the things. And so you might get put on a low dose hydrocortisone steroid sort of regimen treatment. And then if you go for an injection to manage pain, like I did this week with a torn labrum in both of my hips, they gave me double steroid injections, one in each hip. And I, of course, had a vasovagal syncope event, which when you have POTS, all the things kind of line up and you say, okay, my autonomic system just got overwhelmed and sent the signal to my brain, we're going to shut down. And, you either pass out or you feel like you're going to, and the nurse is kind of like, what the heck just happened? And why did you go white? And it takes you minutes, hours, or days to kind of recover from it. But then you're in this position where you're like, what caused that? And why do my doctors disagree? Why do my specialists disagree on what's going on? So you go home and you do research, you turn to Dr. Google, or maybe you're turning to AI, which, can provide some information to help you link things and see patterns. But, that comes with a great caveat of, it needs to be credible or cited medically. And there are particular apps that are built to do that. And we could talk about that later. But, you're in this, trying to figure this out for yourself when you are just frankly not a medical professional. You're just a professional patient. So I have this episode, pass out, feel terrible. A couple days later, I'm going into an endocrinologist to talk about, my overall kind of adrenal insufficiency situation. And, he shares with me, this doctor, that those steroid injections are like, a super boost of these steroid pills that I'm taking on a daily basis. And so your cortisol is all blown and we can't really figure out what's going on with you. And so it's like, why does one doctor not tell you what the impact of one treatment is going to have on a condition? And so you're just like left exhausted and frustrated and in what I call clinical whiplash, because you're seeing these professionals and these specialists that have a single lane, orthopedics, cardiology, and you have these bodies with EDS, POTS, mast cell that overlap and multi-system issues. And the evidence is really hard to sort of peel the onion to get to. And you don't know what to say to what specialist because you don't know what's relevant. So emotionally, you end up in this like, clinical whiplash advocacy hangover where you're feeling guilty about not being able to manage it, but don't really feel like you deserve to delegate and hire help. And you're second guessing. And so this can just be so absolutely frustrating and exhausting. And I'm with you. I feel it. It's hitting me really hard today. So I'm taking a moment to talk about the best way that I can simplify some of this down into kind of broadening our understanding of what's going on in kind of the medical system and how we can learn to translate the language of our bodies into our needs that we can clearly communicate so we can get what we need and get better. And then when we are not getting that, how can we figure out when we might need help, like to hire outside help from a patient advocate, which, if you didn't know, is kind of a new and budding profession that's coming out of the healthcare system, not meeting the needs of consumers. They hire professionals that are trained and certified to help you navigate the health system because it's gotten so wonky. How do you know when you might need one of those? How do you know what they could do for you? How much they cost? Where do you find one? And how do you find one that knows about like EDS and connective tissue, which raises the complexity again? So I'm talking fast and I have a lot to say today, so bear with me, but there's going to be some great nuggets in here. So welcome to the underground. I see you, zebra. So first, let's talk about what I call the medical menu. And this is a metaphor that's pretty simple that, imagine the healthcare system is metaphorically like, going out to eat. And when you go to an expert, 5-star restaurant, the chef that really is like the guy on the bear who is just the expert, he's like the medical doctor, the specialist. They're the chefs. They have an expertise. They make that, steak tartare or whatever it is, the way that they make it, and they make it beautiful. But like they're sort of limited in like those are the dishes that they create. Now, the wait staff at this restaurant, whether it's a 5-star or a dive, the wait staff, those are metaphorically like the nurses. Those are the people who can really help you figure out what's on their menu, like how to get it to be something that's going to taste good and be nourishing to you and, keep you safe. Now, there's a lot of other nuance, but, in this metaphor, you're the diner. You're the person choosing what you want to have fill you up. And so, the specialist can cook the 5-course meal, but there's not really anyone who sort of plans the entire meal, right? And this hidden task of tying it all together can really exhaust people, whether it's like finding the right specialist or the travel or consistently retelling the same story over and over again. I need to be gluten-free, or I have this and I have that. And, you walk in and you're already exhausted. So, in that medical menu metaphor, and we're going to talk about this a little bit later, there's the role of the patient advocate. And in that metaphor, if you imagine them like the food tour guide, it's kind of a separate entity who's studied the area, knows the restaurants, knows which chefs do a really good job and which ones get totally angry and, throw too much bolognese on your pasta if you order it that way. Or they know the tiny little food trucks or the secret places. And this role of the independent health patient advocate can help you really find the meal that is most nourishing to you without consequences and side effects that might make you sick and have a gastro situation. So, if you allow that metaphor, let's talk a little bit about, what happens when like these experts disagree, right? So, you've gone to one expert. And, this is where like self advocacy matters so much in EDS care. It's this invisible workload of managing your own complex illness. And unless you're in it or you know someone who's going through it, nobody really understands how freaking hard it can be because it's, constant coordination, follow up and portal messages and, the cognitive, emotional, and logistical labor of it all. And, we're not even talking about like the insurance part and coordinating that. And then, there's the expense and who's cash pay. I mean, that's like a whole nother episode. But like, you're so tired, even when you have a good doctor, because, getting the appropriate specialist or traveling, retelling your medical history over and over again when you're trying to process this complex information under situations of pain and brain fog, where you're getting anxious in that doctor appointment because you have so much to say, but you need to condense it down. So the best method to do that is to have your one-page medical summary that has your name, your date of birth, your diagnosis that are confirmed, and like your symptoms that are related to that doctor, that specialty only, not the whole big picture, because you're just going to blow their mind and they're going to dismiss you. So come in narrowly focused, clear, and ready to communicate exactly what that provider needs to know. And if you have to prepare and research, go online and, figure out, okay, that's a cardiologist. They're talking about the heart and the circulatory system. So they don't want to hear about my stomach. I need to go in and talk about my heart palpitations and how I was dizzy or, whatever it is. So get some level of that. Always have your medication list on your one pager and your kind of top 3 priorities for that appointment so that you're focused. And that when you walk in and the doctor walks in, you hand them this one-page piece of paper that tells them what they need to know about you and what you're trying to get out of this appointment. And believe me, they are so appreciative. And you don't have to say all this verbal vomit that you feel like you're carrying around trying to get validated. You just go straight into the conversation about what you're there for that day. That's really helpful. That's kind of tip number 1. Get your medical summary. Be able to have those top 3 things that you're looking for, that you're asking for. I need a referral. I need an evaluation for XYZ. I need a prescription. I need to look at why is this happening or whatever it is. Be really narrow, crystal clear. Tip number 1. Continuing to self-advocate through this system when you might get a diagnosis or you're on a treatment plan and you're dealing with like insurance and medication and all the, like this has to go to one kind of pharmacy and then there's the compounding pharmacy, and being able to track all the side effects or the benefits or the reductions or increases in pain and all those interactions is really, really hard. Outsource that to a technology tool like an app and do the work of spending 10 minutes at the same time, put it on your calendar every day of like entering whether it's the pain levels, the mood, the, what happened that day. Because when you do it in those tiny pieces, and then you have the data when you can go into the doctor's office from the app and say, well, this is what happened over the last 3 months, because you can't remember. your brain fog doesn't remember what you ate for breakfast. So use technology, use a spreadsheet, use AI to help you pick up patterns, you know. But going to the doctor with data is going to help you in the long run. A couple of apps that I think are fantastic. Guava Health is an app that was built specifically by and for people with EDS. It's free. Many providers in our community are, offering like the upgrade packages where you can literally import in your records from like MyChart and Epic. And the AI behind the scenes in this app are picking up on patterns. Like, let tech do the work for you so that you don't have to do this. And no, I'm not affiliated with any of these things. These are just great things I'm sharing. So that's tip 2. Let tech help you. Use an app like Guava Health or Primary Record or some of those other ones. Now, navigating insurance denials and prior authorizations, that's its own special beast. I personally think it's a perfect situation to outsource and hire help, which we'll get to in a minute, because insurance and those calls and being on hold and, all of that can really be kind of a breaking point for a lot of people. And imagine you would not go into court without a lawyer to represent you and speak on your behalf. You need to have your mindset that you would not go into like battle with an insurance company in the healthcare industry, their job is they want you off claim. They want you to not be so expensive, and we're expensive people. So hire someone to help you navigate that, and an independent health patient advocate is perfect for that. So, back to the self-navigation tips. When these experts disagree and you're in the DIY diagnosis, like I mentioned, the third tip is to use AI to kind of help you triage. The Perplexity app taps into medical research. There's a lot of other, I'll put some of these in the show notes, a lot of other apps and sites that some of them are even free that you can use to, try to gather information, put it in, tie things together, and let it help you write that medical one-page summary or come up with questions to ask your doctor. It's not about putting your private information out there, because you're not going to put your name and your date of birth and your social security. And there are ways to like have these apps not share the questions and answers with the public. So, there are ways to use this that you can have it help you as an outsourced partner if you're not ready to, hire an advocate. But, always when these experts disagree, like, my endocrinologist saying, do we actually have adrenal insufficiency, or do you have too much steroid in your system from getting it from injections for pain relief? Perfect example of like, how do I figure that out? When you're triaging this, always safety first. Any of these red flags, get to the ER, go to the doctor, talk to your most trusted listening healthcare professional. Pause any changes in your treatment that are non-urgent or irreversible without talking through a medical provider, the consequences of any change. And, ask the question, does this change, impact ABC? Is it going to impact my mast cell, my POTS? Before you kind of blindly do that. And if you're really complex and have a lot of like reactivity from mast cell, you should have like a safety plan that you share from MD to MD so that you can have better conversations. Tip number 4 is, kind of have these scripts in your mind when you're going into the doctor. It's like, it's asking them, quote, can you please document this in my chart? Number one, that your working diagnosis is XYZ, or why you think that, XYZ. And, have these things brought into your medical chart, because the things in your chart are going to go across multiple systems and multiple doctors and specialists and start to tell the story of your complexity. And so you're not going to have to do it as much, like verbally, emotionally, in these appointments. The more data that's in your record. Let's see. Gosh, I feel like there's so much to say. How do you move and know when to decide when you might need a healthcare independent advocate? When the signs could be when you're seeing multiple specialists, which we all are, but like, say you're seeing like 2 cardiologists and 2 immunologists, and, like, it's really getting beyond complex. Or you're getting into a situation where you're having repeated denials and dismissals. Or, like I'm talking about today, where you're having contradictory recommendations that could alter your care. Or maybe you're just frankly so flat out burnt out. This is when you might be so, as I call it, exhaustipated, where you're just too tired to give a shit and you feel like giving up on caring for yourself because you just can't do it anymore. Those are the moments when, like, okay, a patient advocate could help you, right? So the value of a patient advocate, the data behind it is that like 90+% of people that work with an advocate are reporting a positive impact on their care, or like a reduction in a bill cost. And, there's increased confidence and understanding about what that profession is. And the patient advocacy market is expected to grow by like $1 billion just in 2026, and 11 or 12% annually, because the healthcare system is just such a mess. Right now there's probably between like 500 and 1,000 privately paid, independent health advocates currently in the US. And that's according to AFA, which is the Alliance for Professional Health Advocates, which has a directory, which I'm going to put some of that about how to find an advocate in the show notes. But I mean, it's a growing profession. So, consider it, because if you have EDS and you're coordinating across multiple specialty, and you're kind of getting this repeated emotional and cognitive labor of having to do this over and over again, if you hired someone who could like send these messages on the portal for you, or make a phone call on your behalf, or call insurance for you, like, what a load off of your mind and body, so that you could rest and restore, try to like feel better overall. So what does an independent patient advocate do? They coach patients in things like self-advocacy or preparing for doctor visits. They can translate like complex records or jargon or MRI reports. They can coordinate care and referrals and getting all the medical records into like a single place. They are certainly skilled at like the insurance appeals, getting billing reduced, cost issues, like if you need a surgery, they can help you kind of find the right expert. But they really support like your shared decision making as a peer, kind of at your level, like a lawyer would defend you in court, and they're defending you kind of in the healthcare industry, because they're not replacing your clinician. They're not replacing you or your loved ones. They're just assisting, right? And you can have them do as much or as little as you might want. Now, typically, if you hire one, they're independent, which means they're paid by you. And that is the allegiance factor that you always need to ask about if and when you hire one is, say, for example, you're a complex patient and your insurance company offers to give you a patient advocate that's employed by your insurance company. Who are they paid by? Your insurance company. So what's their motivation? To get you to reduce the amount of costs and claims. They're not working for you, they're working for the insurance company. So when you hire an independent advocate and you pay them, they're working for you. So be sure that you're paying attention to that allegiance factor, because when the hospital you just got checked into offers you an advocate, don't be confused that that advocate is working for you. I mean, they might be kind and wonderful and doing great things, but know who's paying their paycheck, because, they might have kind of this like conflict of interest of what's best for you. And so just keep in mind, if the patient is not paying, then the patient is not the priority. So, how to find, a professional patient advocate? There are several directories out there, and I'll put the links in the show notes. There's, the National Association of Healthcare Advocacy. There's the AFA one that has a directory searchable site called Advo Connection. There's GNA Now. And then, if you need to look for someone that might be able to do free work, you can contact the Patient Advocate Foundation. It's a nonprofit where they can offer all kinds of support when you just need some help. But that might mean a little more like thinking and logistics work on your half. But there are some EDS specific advocate lists out there. And then the EDS Society is running trainings to put people that are prepared to be advocates through a process so that they can learn how to do this. So, if you can afford it, you have to think about it. You only have time, money, and energy as your resources. And so, what's more important to you? Do you have enough money to outsource something so that you have a little more time or a little more energy? And only you can make that decision. But, if you're trying to navigate these complexities and you're trying to DIY your doctorate degree and you're consistently trying to research and find information, and you're on Reddit reading reviews about, it's just so exhausting. But, learning how to find help when you're just running on empty is really important. So the key takeaway today is, advocacy for yourself is not about speaking louder, right? It's not like yelling at the doctor because they don't hear you. It's about getting yourself as prepared as you can to be as clear of a communicator in those magical 12 minutes that you have with the doctor. And a great way to do that is with that one pager. And another way to do that is to bring in an outside person. If you can't hire an advocate, bring another person with you. Ask permission to record the call or record the appointment so you can pay attention and not be scribbling notes like crazy. Bring a male with you. If you're female, you're a lot less likely to be dismissed. That's a whole nother topic. But, needing help does not mean that you're like a failure. It means the system is really not set up for, one person to be able to carry this load. And so the system is changing, and there's a profession that's budding out of it because people need to hire help. I hope that this has been helpful. I hope that, these kind of real world strategies can help you figure out, if hiring an advocate, gives you the ROI that you want, and, if you decide to hire an advocate, here's a couple of questions to ask them. Obviously, who pays you? Where's their allegiance? Do they have training or certification? Are they a BCPA? Do they work with complex or rare disorders or with EDS? Understand what they're going to do and what's going to remain your responsibility. And, how are you going to communicate with that advocate? Do they have a portal? Are they going to email you? Can you text them question? And then be sure that you understand what counts as their billable time. Because if you're texting them and that counts as billable time, it may add up quicker than you realize. You know, ask them, how are they going to define success for you? And how might they handle, um, if you and them have some sort of disagreement, because they're supposed to work on your behalf. And then always ask, if something feels like off about the advocacy relationship, can you pause or stop, the services? Are you in a contract? How does that work? They typically have like an hourly rate, or you can buy a package of hours, or you can be on a retainer. And rates typically run anywhere between $50 an hour to like $200 an hour, which may sound outside of your affordability, but you know, you have to change your thinking in terms of, what if this person could help me get pieces of my life back so that I could feel better and I'm not so exhausted by all the things that I'm doing. Watch out for people that are going to guarantee you an outcome, or trying to pressure you to sign, or, talking over you or minimizing all your lived experience. Those are red flags. And, you know, I hope that this helps, when you're in, like a health crisis, or you're in a transition point where you might have more of a need, like getting a new diagnosis, needing to understand it, having, a relocation where you have to establish new providers, or you're planning for surgery, or you're doing disability paperwork, or you faced like a major flare or a loss of a bunch of function, so a lot of the short term kind of task based things, maybe you do your own self advocacy. When it's getting really complex, maybe you consider, hiring it out. And again, this does not mean that you failed anything or you're not doing it right. That your body and the healthcare system is very complex and just not built for you. And so you are not, and never are you going to be too much. You're just navigating too much. So I hope this was helpful. I hope that you find some answers, and that you have enough resilience to work your way through the next flare, the next diagnosis, or the next thing that you have to learn how to advocate for on your own, and that you can hire help or get pro bono help when you're able. Thanks for being with me here in the underground. Thanks for your patience as we all are learning how to be a patient. If you want to hear more from what I'm doing, you can follow me or subscribe on Substack at Zebras Underground, or check out my advocacy website at journey2joyous.com, or read about my book on hypermobility. That was a bestseller inside 24 hours of coming out, because there is such a need for information on how to deal with EDS. And you can learn about that at holdingitalltogether.com. Thank you again. Be well, my friends.